My name is Kay Dickerson. My husband Tommy and I are Hurricane Katrina survivors. We lived in Westwego, Louisiana for a number of years. It's a little tiny fishing village, and it's very close to the shrimp lot and the public docks, and we used to go fishing every day. Mostly I spent my time as a children's librarian, and I really enjoyed it. My husband did a lot of volunteer work with me. That particular year, we had already left and gone out of town twice, just in case the hurricane came through that way. Nobody was going to do anything for Katrina because everybody was like, we're just so tired of this, it's just ridiculous. And it was the end of the month. My husband and I had $7.49 in the bank. And so, trying to buy a ticket or pay somebody for gas just really wasn't an option. So we just decided we'd ride it out because we thought we'd be okay. But it wasn't so okay. Now, we were in an older home that was up off the ground. And what happened on our side of town was we had tornadoes. And the roof came off of our house while we were in our house. And that was pretty much the most terrifying thing that's ever happened to me. After about a week or so, that's when it really started getting very rough. And it was dark at night. It was pitch black dark. As soon as they opened up the parish line and said you could go in and check on people, our friends that had left us behind came back and picked us up and got us. And we had about 20 minutes, and half of a pickup truck said, okay, we're here, we found you. And they thought we were dead for sure. And they came and picked us up and took us to Beaumont, Texas. When Tommy and I moved here, OHSU Richmond just happened to be doing the medical part of the relocation center there at Washington High School. And they said, Mrs. Dickerson, we hate to tell you this, but you have a number of serious health problems. They said, don't worry about a thing, come to our clinic, we will take care of you. And so that just kind of fast-tracked me into the healthcare system and got me immediate help. We have wonderful people here in Portland. I've really learned the meaning of paying it forward, and I was really anxious about going into advocacy and helping people to make sure that people that are on the bus or people that are on the streets or just everyday citizens know about how to get affordable health care, how to keep up with their health care, how to improve their quality of life, because I didn't realize how sick I was until I started getting better. So I'm in the CHEA group at CareOregon now. That's the Medicaid group, and CHEA stands for Community Health Engagement Advocates. The CHEA group has done a number of things. We've done a fundraiser at the Boys and Girls Club out in North Portland. We've also participated in a day at the Capitol down in Salem. We've had open houses at the CareOregon building and teach people more about their health care and how to be active and how to be proactive and how to do preventative health care so they don't end up in the emergency room. My husband and I have talked about what our lives would be like if we hadn't have left New Orleans. My husband is the youngest of 7, and all of his brothers and sisters have passed away, and even some of his nephews have started passing away because the health care in New Orleans is substandard. Honestly, I don't think he would be alive, and I would probably be in a nursing home if we were still in Louisiana. It's the truth.